So there's a question in life that no one really knows the answer to. And that's what's going to happen in the future. And we can't answer that one with 100% confidence because it hasn't happened yet. But imagine we had a way to really know what's going to happen in the future. A button that could transport us and give us a glimpse into what's to come. Well, here's one I prepared earlier. This would be cool if we could press the button and transport into the future. We could truly find out how much artificial intelligence is going to transform healthcare. Will we ever be truly user-centric and put the patient in the centre of care? And will technology actually have a transformational impact on issues like equity and access?
Sure, not everyone has a button like this, but you know what we do have? The Digital Health Festival in Melbourne.
And Talking Health Tech is going to be here front and centre.
And that's where I'm setting up today. And
Wait a minute. Yeah, that was heaps easier than last time. Here at Digital Health Festival, attendees get a glimpse into what the future of healthcare might look like. And we're bringing you in this episode insights from speakers and attendees and exhibitors and anyone else attending the event today. I'm not alone here at the event either. We've got an army of THT ambassadors who are here representing Talking Health Tech on our booth, and they're passionate about collaborating in the health tech ecosystem.
collaboration starts with a conversation, Team Health Tech. Let's make it happen. This is Talking Health Tech with me, Peter Birch, featuring content and community about technology in healthcare.
Hey Nathan, I'm Naren Gunja. We know each other from a previous life, of course, and a current life, really. I am the Chief Medical Information Officer for Western Sydney Health, and I'm here at Digital Health Festival. It's a real buzz and enjoying it. I'm speaking this afternoon about the digital hospital and what it means to get your healthcare facility into a digital platform and be able to run it in a way that automates a lot of processes and streamlines efficiency for patient care.
Fantastic, admirable goal. Hopefully we'll get there soon. So I guess speaking of that soon, what does the future of healthcare look like for you?
We know that inefficiency in healthcare systems comes from a lot of manual processes that require you to physically be somewhere. And I think the future is going to be about mobility and being able to get things in the palm of your hand. It's not going to be that you have to sit at a particular computer terminal and do something. It's not going to be for the patient that they have to go to a particular place in order to get the care that they want. It's about getting and doing what you want where you want to do it at that point in time. So mobility, I think, is going to be and accessibility anywhere, healthcare anywhere, essentially, is, I think, where health is headed.
Well, I'm the CEO and co-founder of Nutromics. I'm here to do a presentation on our medical wearable technology.
Okay, great.
Which you can see here.
Tell us more about those.
Well, this is a medical patch that you wear. It's for the ICU, so in hospitals. And we have a technology that can monitor any diagnostic target continuously and in real time. So for the people listening and watching, the closest technology is continuous glucose monitors that diabetics wear. You might be familiar with that. And that technology has revolutionized the treatment of diabetes, but it can measure only one thing, glucose. So this is the evolution of that tech because we've got a technology that can monitor any diagnostic target. So we can do proteins and hormones and drugs. And it means we can solve problems that have been around for decades, but no one's been able to develop a technology that can provide doctors with continuous readings. And it's really for targets that change rapidly.
Yeah, and trends, right?
And trend data. So things like therapeutic drug monitoring, early diagnosis of disease states. So any time where you need to get diagnostic data quickly and you need trend data, like you said, that's where this is useful.
Wow. Yeah, that sounds so exciting and very new. And so what are you going to talk about on stage today?
I'm going to do a general introduction to the technology.
Yeah.
I'll have the product we're going to be taking to the market, which is what I have in my hands here.
Yeah.
Really lay out the plan for how is this all going to work? What are the first markets we're going to go after? We're going to revolutionize diagnostics with this technology. That's a big claim. And I'm going to lay out the foundation for how we're going to do that with credibility and who we've got on board to make this happen, and all the partners that we have. The company and all our partners are really excited. We're going to be announcing new board member that people will know. Yeah, so general overview.
Yeah, wow. And tell me a little bit more about the wearable. Is it like diagnostic via blood sampling, or is it like it sits on your arm? So tell us how you...
It does, yeah. So we actually operate in interstitial fluid. So a lot of people don't know what that is, but essentially just below the skin, we have this fluid. And the best way to describe it is if you've ever had a blister, the fluid in the blister is interstitial fluid. We are bathed in this interstitial fluid. We have 3 times more ISF, interstitial fluid, than blood. We have these little microneedles that you can see in here. Yeah. They're only about 2 millimeters long. And when we apply that to the skin, on the tips of the needles, we have our sensor. And that's enough for us to actually read continuously almost any diagnostic target. It's the same fluid that continuous glucose monitors use, right? Yeah. And so that's how we can have a very minimally invasive device. We don't have to go into the blood, and yet we can still monitor those targets continuously.
Yeah, wow, that's so
very
exciting.
User-friendly.
Yeah, very exciting. So tell me, last question, what do you think is the future of healthcare, and what excites you about the future of healthcare?
That's a crystal ball.
It's a loaded question.
Don't have a crystal ball, but I can tell you trends, things that are happening. And one big trend is remote patient monitoring. Every stakeholder wants remote patient monitoring to work. The patients prefer it because they much prefer to be treated at home if possible. Hospitals prefer it because it's cheaper and it allows beds to be used for people that are sicker, basically. Payers prefer it. So everyone prefers it. And it's happening, but it requires enabling technologies to allow that to occur. And this is an enabling technology. So when you can monitor someone remotely, because we have a Bluetooth, goes to a cloud, so you can monitor someone anywhere in the world, then you open up these opportunities where patients can be dosed drugs at home, because now you can do it safely. Or if they're at risk of cardiovascular disease or kidney issues, we can monitor biomarkers continuously. So they're not waiting for symptoms to occur, and then it can be too late sometimes. We're monitoring them at the earliest possible time, because it's the equivalent of having a blood test every minute.
Yeah.
But it's not invasive, and it's it's doable with this technology. So that I think is exciting, and we really have plans to participate in a major way in making that happen. Not just watching it, making it happen.
My name's Simeon. I'm the director of a company called Healthcare Panel Asia and a startup called Hippo Health Intelligence. We're market researchers basically for the healthcare industry in Asia.
Okay, fantastic. And so what are you here to talk about at the Digital Health Festival?
Digital health, digital health data, the democratization and decentralization of data, health data, specifically patient data or personal data, using blockchain technology and AI to enhance the experience, I guess.
Okay, and so is that with like a focus on security and privacy?
Well, in our industry, we collect a lot of data for pharmaceutical companies, for the healthcare industry. Most of it's siloed.
Yes.
We collect it, they look at it, then they silo it. Our idea is that each time you give us data, we keep it anonymously, and then if we create data sets on a marketplace, if somebody buys that data, you get incentivized each time. At the moment, they only get incentivized once for giving us the information, doctors, nurses, patients, but we want that data to remain accessible and then keeps incentivizing the respondent.
Yeah, really interesting stuff. And for you, what is the future of healthcare?
I think it is digital, and I think it's making it more democratic and global, so that someone in a country that doesn't have access to good medical services can get on a Zoom call and connect with a specialist in another country or in a bigger city, so that people have that better access to healthcare. At the moment, it's not very equitable.
Yeah.
So my name is Maddie. I am the Virtual and Digital Health Manager at St. Vincent's Healthcare Network, Sydney. I'm a physio by background. I still work clinically a little bit. So I kind of manage anything virtual and digital that sits across the network, remote patient monitoring, telehealth, kind of the project management implementation of those systems and programs across our hospitals.
Oh, fantastic. What brings you to the Digital Health Festival? What were you talking about? What are you going to be talking about?
So I'm presenting tomorrow, co-presenting with a vendor called Care Monitor, which is the platform that we have been using for remote patient monitoring. And we're presenting on our key lessons that we learnt from actually moving out of COVID. So we stepped up our remote patient monitoring platform very quickly during COVID, in response to COVID. And we've been working over the last kind of 8 to 9 months of moving beyond that and how do we extend our program into other cohorts and services. And there's been a lot of work that we've had to do to kind of pull apart the things that we did during COVID and almost start again in a sense and setting those foundations up. So yeah, we're presenting on the key lessons that we've learned in that process, being things around kind of resistance and change management, that integrating data is very difficult. And some things that we would do differently if we did it again next time.
Fantastic. And so look, a final question for you today. What do you think the future of healthcare is?
Future of healthcare. I mean, we're at a digital health festival.
Yeah.
I think really it is going to be breaking apart that concept of a hospital and healthcare walls. That we're still in a place where our care happens primarily in a hospital. And I think very quickly we're going to see that's not the case. And you really only are coming to what we currently call a hospital if you're critically unwell or needing intensive care or that type of thing. And everything else is going to happen at home.
Yeah, so we're here with OutSystems. We're co-exhibiting with them. We're sponsoring the conference as well as a gold sponsor. And OutSystems is a low-code platform that allows us to build any application really quickly. So things like web portals or mobile apps or back-end integrations or anything like that. Serious apps, not just simple things. And what we have contributed to this conference and to the OutSystems developer community is a library of healthcare interoperability components. So that makes it really easy for developers to work with healthcare data and then transform that data into an interoperable format so that they can exchange that with a hospital system, for example. The standard for interoperability is the HL7 FHIR standard, and there is lots of nuances to it, like the Australian base extensions to that profile. We found that a lot of developers struggle to get the complexity of what that is and to work with that, and they tend to oversimplify it and then run into problems. So what we've done is we removed that complexity so they can deal with simple data structures and then feed it into the components that we built, and it generates the FHIR resources, or it can take a FHIR resource and transform it into a simple data model that developers understand.
Yeah, great. Well, I mean, everyone's speaking about interoperability is such a big problem, and
Totally.
It's cool that you're the one bringing the solution to it. So,
well, I was at the Digital Health Festival last year as a delegate, and I heard a lot of talk about how great it would be if we had interoperability and what a difference that would make. I used to work as a CTO for a practice management software, and that's where I came across interoperability for the first time. That's where I fell in love with it, I guess. And then for 5 years, I've been doing other things, and I haven't really done anything with interoperability. So it really surprised me last year that there's so much talk about this, and it seems like we haven't really made much progress.
No.
And so that's when I decided that one thing that has changed in that 5 years when I wasn't paying attention is that I've built a team, a very capable team that can build complex solutions. And interoperability is complex. And we figured, let's see what we can do to help the cause. And let's see if we can come back next year and present something that is useful for people to actually solve the problem with.
That's great. That's really good. So, I mean, have you been speaking on any of the stages?
Yeah. So we had a session this afternoon on the sci-fi stage, and one of the fun things we did was we wanted to show people how we can build a mobile app from scratch, live on stage, in less than 5 minutes.
Wow.
That produces a FHIR interoperability resource based on the data that we capture on the screen.
Oh, wow.
And my lead developer was the one driving, and I was explaining what he's doing. And he did it in 4 minutes and 33 seconds, I think.
Wow. I would have loved to have seen that. Yeah.
Yeah, and it's available on our website as well.
Yeah.
So there's a recording of the demo that we did.
I'll have to have a watch.
Yeah.
So my last question for you, it's a loaded one.
Sure.
What is the future of healthcare then?
The future of healthcare is connected. That's as simple as that. Like, I can't imagine anybody trying to build any digital health solution today without thinking about how that's going to connect to other providers or other systems to exchange data. So I think that, that's what we believe, is that connected collaborative care where people have choices, they can move, they do move, like, for various reasons, and they can own their data, they can share the data with whoever they choose to or they need to. That's what I believe is the future of healthcare.
Yeah, right. And my last unscripted question for you
Yes.
Is it starting new or is it building from the old?
The platform that we use, our tool of choice, OutSystems, allows you to build a custom solution from scratch. Just like we demonstrated on stage, we built a mobile app from scratch in under 5 minutes.
Yeah.
So it's most suited for people who have a unique idea, something that there isn't anything out there yet that solves that problem. And we can collaborate and build a solution, a custom solution for them. And then what sometimes comes as an afterthought, the interoperability, now we need to integrate with the hospital system, and they won't talk to us unless we integrate with them. That's where we provide these components that make that transition really easy to build that layer.
I'm the General Manager of MARTA Pathology in Queensland and for the MARTA Group. So we do both public and private testing of all the hospitals in the Greater Brisbane area. And what I'm speaking about today is about we've been fortunate that we've been given some Commonwealth funding to look at drone transportation of pathology and pharmaceuticals in our Greater Brisbane area. We have got some sites that are in the Moreton Bay area. So we've got collection rooms on Russell Island and also on Macleay Island and also on Stradbroke Island. And we've got big Aboriginal and Torres Strait Islander communities on those islands. And the GP community out there do a great job of supporting the community, but they do have to wait extended times for their test results because of the transportation delays. We've either got traffic in the Brisbane area or we've got ferry terminals that we have to work in with. And sometimes patients arrive to get their blood tests done, but because of the time sensitivity of pathology tests, they're actually asked to come back a bit later. So they'll meet the ferry terminal and then go transported across and then get into the lab by the required 4-hour period. So that's the opportunity that we've got with drones, is that 4-hour transportation time can be reduced to 10 minutes.
Wow.
And get to the lab. So, and that means that the GPs are able to make informed decisions for their patients rather than, taking a risk as to do they transport that patient from the island to the mainland, or do they just leave them and hope that their diagnosis will be correct.
Fascinating. It's very exciting.
Yes.
So what's the future of healthcare?
Look, I think the future of healthcare is that we've got to get together and actually work well with the interoperability between systems. And over the conference period, we have heard the word interoperability many times. It's something that we've been talking about for many years, but I think there's a bit of momentum now to make that happen. I think COVID was a really good launching pad for that, where the community understood a bit more about what the importance of diagnosis is, but also really took hold of their own healthcare. And I think the introduction of rat tests, where people were responsible for a little bit of testing of their own health, has been a step forward. And I think now that the community is pushing the healthcare providers, we might see some advancements in that. The big thing for me is that obviously we're the first in Australia to look at drones. We're working with Queensland Health on that because they've got a very large network of pathology laboratories. And they're looking at laboratory to laboratory transport. I'm looking at laboratory to laboratory, but also collection centre to laboratory. What we need to make sure with the drone implementation is that the interoperability is there from day one. We don't want to get proprietary systems popping up everywhere and then have to worry about interoperability later. So I think, devices are getting smaller. People are taking command of their health. I think it's a very positive future.
So I'm Kylie Ovenden. I'm the Regional Health Innovation Hub Manager at Bendigo Health.
Okay.
So not many people know, but Bendigo Health Centre of Victoria. So, and we're the lead hospital across the Loddon Valley region, 16 hospitals in our region. So 25% of the landmass of Victoria and 350,000 people.
Well, they represent. Well done.
Yeah.
So look, you're here at the Digital Health Festival. What were you talking about?
So we were actually talking about using IoT in the health world. So it's really about taking technology that really exists in agri and is used quite widely in the agri sector, bringing that into health and using some of the IoT networks to remotely monitor our patients. So as I said before, we're 25% the landmass of Victoria, but only 350,000.
Yep.
So some of our patients are quite remote.
Yep.
So it's really how do we deliver the care
Yep.
to them where they need it in their home?
Yep.
When connectivity is a challenge.
Yes.
And IoT networks are one of the answers.
Yeah. Fantastic. All right, so the last question from me today is, what does the future of healthcare look like for you?
Well, I think the future of healthcare is much more about empowering the consumer, empowering the patient. So moving away from the medical model, the traditional model we have, and more to the social model. Changing behaviours, empowering people to make their own decisions. Instead of just trying to fix people, let's help empower them to live a better life.
I'm the Chief Innovation Officer of the Digital Health Cooperative Research Centre. That's an incubator and funder in the digital health space. I'm the guy with the crystal ball, trying to suss out what the next big things are and then making sure that we raise enough awareness and tie together projects and activities that help to translate those ideas into real-world impacts.
Wow. So you've been here talking today.
No, I will talk tomorrow. There's actually 3 things going on tomorrow. In the morning, I will moderate a very high-profile panel on the responsible use of generative AI in healthcare that will feature very exciting panelists. Then there will be a talk at around noon, which I will give on the same topic. And then I'm delighted to be one of the Pitch Fest judges in the afternoon.
Fantastic. So you've got a big day ahead tomorrow.
Yeah, very much looking forward to it.
Awesome. So in your crystal ball, looking down it, what is the future of healthcare?
Generally, this has... You cannot have a discussion about that without after 1 minute mentioning the famous ChatGPT, right?
Yeah.
But dialing down that hype a little bit, I wanted to say that I'm generally excited about what AI, not just the latest craze, which by the way isn't so late, it's just come to the surface, but it's been out there for a while. But really also more, shall I call it, established AI technologies can bring to healthcare. So it's really that excitement about the transformative role that AI as a tool to assist human decision makers can bring to healthcare. And that is for both, not just for clinicians, for just patients, but for both of them. There's a lot of potential in there to change their experiences, their workflows, their productivity, quality of care, patient experiences through the intelligent and safe use of AI in the future.
Yeah, sure. So I'm the CTO of Aurabox. We're a cloud platform that allows doctors to share and collaborate on medical imaging. So we're solving a big problem in healthcare in Australia, which is that doctors can't access the imaging that they need in order to treat patients when they need it.
Yeah, wow. And is that from a perspective at home, or is it in the hospital, or anywhere you want it to be?
It's kind of anywhere. So like there's actually a lot of organisations using imaging maybe more than you might expect. So like sporting organisations, for example, professional sporting teams, insurers, medical second opinions, like lots of people need to kind of get access to patient imaging, and patients want them to have it when they need it. But there's no good way for them to kind of mediate that relationship. So for the patients to go, yeah, here is all my imaging and it's in one place and I consent to you using it in the way that you need to use it. So that's kind of, that's where we're stepping in and solving that problem. And it applies more broadly to hospitals and specialists, especially for specialists who are dealing with a lot of clinical usage like oncologists or, brain surgeons, those sorts of groups.
Yeah, I'm a traumatist by background.
Okay.
So I look at imaging once a week with the radiologist, and we sit down for an hour and we talk through these images.
Yeah.
You see having people's previous images that might actually have them as a baseline, they might have something different. But we don't know that because we're just seeing the images from today after the trauma, which could have been caused by the trauma or it could be chronic. We're not sure.
You don't know. Yeah.
Exactly. So that's amazing. And I can see a massive use in that. So very cool. So tell me what you talked about on the stage yesterday and what stage were you on?
So we're on the sci-fi stage. We were talking about cloud adoption, which is a subject that I've been involved in for quite a while, 15 years, but is unfortunately incredibly dry and boring. I'm not quite sure what the key takeaway from that session was. I think there were a lot more people interested in it than I thought there might be. I kind of feel like talking about cloud too much is a bit of a distraction from the real issues. You want to talk about how you can improve specific aspects of what you're doing, and maybe there are some cloud techniques or ways in which people engage with the cloud. For example, how do you orchestrate your applications, or are you running across multiple availability zones, whether they are physical infrastructure or some cloud infrastructure? Those are good questions to ask, but maybe have you adopted cloud as it's not really relevant, unfortunately.
Yeah, whether it's access or if it's organisation or efficiency, just trying to work out those things.
Yeah. And healthcare's slightly different. Like if you've just bought Epic, New South Wales government, I'm looking at you. If you've just bought Epic, your cloud journey is kind of over at this point, right? So you've got to work out some other way to work out how you're going to engage with companies that are moving data around through the cloud, because that's where it goes, and how that's going to work.
Great. So the last loaded question for you is, what do you think the future of healthcare is?
Well, it's an interesting question in Australia right now. Like, probably, I would have said interoperability is the future. The ability to move data around for patients when they need it, where it needs to be. There's a lot of talk at the government level about what that's going to look like. Personally, I'm pretty sceptical as to what they might achieve there.
How long?
And in how long. The healthy skepticism is important. They've got grand ambitions, so we'll see what that turns into. But I think even, we're seeing a really strong interest in just the ability to get imaging moving a little more freely between organisations. So the need is there, and that will drive adoption of interoperability solutions. There's probably not enough here today. There needs to be more.
Right, so Sophie, I am a obstetrician and a gynecologist, and I'm based in northern beaches of Sydney. And I'm also a clinical educator, so I'm a clinical senior lecturer with both University of Sydney and Macquarie University. I've always had a passion for management and administration in addition to my clinical role, and I think that is what has led me to digital health. I wouldn't claim to be anything more than a mere clinician, not very clever with the IT side, but I believe that the partnership between IT or digital health and clinicians is so powerful.
So you were lucky enough to be on a stage.
Yes.
This last couple of days. Can you tell me a little bit about what you were speaking about?
Right. So Sophie, I have set up a multidisciplinary care model for women, and it includes a GP specialist, and as well as a urogynecologist, a colorectal surgeon, a specialist with interest in endometriosis, a physio, nursing and midwifery representative. So it's like a very holistic view on women's health. And I wanted to share that and
go through I basically got an opportunity to share the gains that we have noticed in our practice, as well as the pain points that we have, we continue to battle and try and minimize with time. So it was good because I truly believe that that's the future of women's health, and that's the standards that every woman deserves. And so I was really privileged to be able to present our model of care.
Yeah, wonderful.
Yeah.
So in terms of the future, how do you see the future of healthcare?
I think the future of healthcare is so exciting. And isn't this festival a testament to that? 5,000 people are coming and show an interest in this field. And I think that we're going to constantly see that clinicians will bring their talent to the table, but we will hopefully have more and more automation of the mundane tasks and minimization of inefficiencies, and just I think patient engagement is so important, and it's not really going to happen unless we have more robust apps and more robust portals, and we put women and patients at the center or at the forward, like patient-led systems. So I think that will be empowered with solid digital technology. And certainly, Sophie, from my model, MDT needs to rest on a very solid digital foundation to thrive and to prosper, because I am aware of quite a few that haven't survived because of the complexity of the system. And so I'm very passionate, but also mindful that we actually need this, not want this.
Yeah, wow. It's anything that can give us more capacity to have that time with patients and activate them in their own healthcare is an exciting space.
I agree, Sophie. So I sometimes get asked by my peers that, oh no, it's going to replace, it's going to this, that, or, and I think that no, actually what it does is it gives you more time to talk to the patient because you're not caught up in the paperwork. Yeah. So I think that's the approach that clinicians now need to sort of embrace more because, typically, especially doctors, we are a bit resistant to change.
I think we all are a little bit in healthcare. We like it nice and slow.
Yeah, and how we've always done it.
And how we've done it. And I think, we're moving through such exciting times of being innovative, and how can we better serve our communities?
Absolutely. One pain point that I constantly, battle with is lack of interoperability. And I think forums like this are so good because they are at least having that collective voice of so many of us saying, please make things interoperable, because it's such a pain to have to, having silos and different parallel systems that don't talk to each other.
And that's,
sorry, I had to debrief there.
No, absolutely. And I think that's, it's been such a buzzword these last couple of days is interoperability.
Yeah.
How do we do that, and how do we bring the interoperability in something that is such a complex problem to solve?
Yes.
And that, I think, is the next step.
Yeah, exactly. Now I know that fire is not just the normal fire that I used to.
I'm a GP. I work in private practice in Sydney. I also have an academic role, but my main job and what brings me along to Digital Health Festival is as president of the AMA in New South Wales. And one of the things I really wanted to see at this conference is more clinicians and maybe the medical professional leadership groups from colleges and my organisation be here to actually be part of this conversation going on, because there's so many great digital health providers and researchers and people funding the system here, but there needs to be more of that discussion with the frontline clinicians that go on.
Sure. And you spoke yesterday, so can you tell me a little bit about what you spoke about and your key message?
We talked about kind of revolutionising virtual care and what it has meant for the Australian healthcare environment. I think some really good things out of the Calvary Medibank virtual hospital running in South Australia, which was really interesting. I think from my perspective, it was very much about how you joined up the right clinician for the right patient at the right time in the right place. And so virtual health has its uses, but it's not the be-all and end-all for our system. And when you come to recognise that not everything is virtual, but not everything is face-to-face, and you find that balance, and we work out how our systems can appropriately put the right patient in the right place, and then connect the clinicians with them, that's how we'll get the best for everyone. And that, that includes dealing with the kind of terrible postcode lottery that is, being a patient in Australia. If you're somewhere where there's easy access to face-to-face services, then all of a sudden you get better healthcare. Whereas if you are somewhere further away, our system means that you actually use less healthcare. You often have worse health outcomes. So we want to try and do things that help improve those health outcomes for people wherever they happen to be.
So what's the future of healthcare with that in mind?
We don't talk about digital banking. I think we're going to have to get to that point. We don't talk about digital health. We talk about health because these services are already intertwined completely into our health system. They're in everything that we do, and they've been there for a long time. We're talking about digital, but I mean, we've had electronic medical records, we've had clinician-assisted diagnostics in radiology for years. We need to start thinking of that as part of just a digital health continuum or a health continuum that our patients can use, our clinicians can use, and that's where it's primarily, I think, been directed before now, and it also starts delivering on that quadruple aim of healthcare. So we're getting better health outcomes, we're getting better value out of our healthcare outcomes, we're doing better community health, and we're getting a better experience for clinicians as well. And I think that last one is important, and that's why I want more clinicians to be at events like this, because we've got to include them in the design of new technologies so that they're actually going to be part of that future, and they're not just going to say, I'm going to do it the way I used to do it.
Sure. How have you found the mix of the clinicians here at Digital Health Festival?
There are lots of great clinicians here. Many of them, however, are already the digitally converted. They work in this space. They are, intimately connected to the delivery of health technologies into hospitals or into primary care, into public health systems. What we need to get is more people who are just on that fringe of technology adoption and show them what's available, what's happening, and how to be part of the revolution in digital health so that we can actually have technology that means something to them when they go back to see patients every day, and deliver the healthcare that people across the country need.
For the digitally converted, what is a takeaway or something that we can take back to our workplaces to help bring those that are on the fence or not quite there into thinking of health it's already digital but moving forward?
Healthcare is built on evidence, and one of the ways in which we generate that evidence is to actually work with the tools that are developing and being built. If we want to be part of that new kind of eon of healthcare, then I think you need to be a contributor. You don't have to be the first adopter, but you certainly shouldn't be in a situation where you don't understand what's going on. And that's what I hope everyone gets out of coming here, or even when they go back to their own organisation. It's that to know about what's going on is just as important as being the first adopter of everything. Everyone's always got a first adopter in their practice or in their department or in their group. You don't have to be always that person, but you should know what's coming down the line and understand how it's going to change your specialty or your area of healthcare practice, because if you don't, you're just going to get swept along rather than being someone who's got some control of where you go and how the technology helps shape your practice.
My name is Prash. I'm the co-founder of Enosis Therapeutics. I'm a psychiatrist, and I run a startup that looks to reimagine what the future of telemental healthcare would look like in a world of three-dimensional screens.
Great. And you did a talk on the stage, was it yesterday?
Today, later this afternoon.
This afternoon. And what's your talk going to be about?
It's on the use of technology in sort of innovative healthcare approaches. And in this case, I think it particularly focused on our work in using virtual reality-based psychotherapy in psychedelic therapy.
Yeah, right. And can you tell us a bit more about that in terms of your work and what your product is?
Yeah, and psychedelic therapy exists as a multiple-part process. There's the actual psychedelic component, and then there's all the psychotherapy parts of it, which is what allows any change that occurs to become sustainable long-term psychobehavioral change. We considered the fact that so many of the insights that emerge in the psychedelic session tend to sort of disappear and wither away and aren't always retained. And we started thinking about how we could leverage technology to help better retain those insights and turn them into a model that was able to fit into general models of mental health care delivery. And that's what we've built out in virtual reality.
Wow, that's very cool. So I guess in moving through that in the mental health side of things and the psychedelic therapy and what your purpose is, what do you see as the future of healthcare today?
I think the future of healthcare, I'll specifically focus on mental healthcare, is inevitably remote. I think we've tasted the Kool-Aid of healthcare from the couch, and we're unlikely to go back. But in doing so, I think we need to consider that screen technology is changing and shifting, and it's moving gradually from two-dimensional screens to more immersive screen technology. Apple's recent VR headset release is a major signal of that. And so if it is moving in that direction, then we need to be designing technologies that leverages that immersive three-dimensional modality, which raises both a problem and an opportunity. The problem being that the way we conduct telemental health now isn't fit for purpose for immersive screens. And the opportunity being that with this new technology, and the extra sort of physical dimension that we're now able to access, we're able to do things that we previously were not able to do. In that virtual world, immersive world, where there is no physics, we can do things that the real world does not allow us to do. And how we leverage that technology to be able to optimize mental health care is going to be, I think, the future in which the industry moves.
Yeah, wow. And I guess the one question that is continuing to come up over the last few days is, how do you see, I guess, the regulations and that base of approvals and keeping within, patient safety, and how is that, I guess, impacting on sort of your area of work?
Yeah, I mean, I think it's interesting to look back at COVID and the shift that had on enabling or really boosting the reimbursements, for example, for remote health. It took such a global event to really accelerate the reimbursement of something which already existed and could have been mainstream, before this. As we move into, and again, speaking of my world, as we move into more immersive technologies, I think the capacity to be able to pre-design prescribable psychotherapy sessions, which a virtual world allows for in a much more seamless and intuitive and engaging manner than two-dimensional screens. That's going to be a major shift forward, and whether we can get reimbursement and prescribing, I guess, PBS type reimbursements on that as digital prescriptions is going to be the interesting shift that we wait to see whether the regulator will come to the table on.
I'm Dr. Liz Berryman, and I am the founder and CEO of Channel, and we are a connected frontline wellbeing solution. Yeah, so what we do is we do data and insights on how workforces with your wellbeing. We also monitor the environment and something called psychosocial risks. So we're able to help organisations to manage and monitor their employee wellbeing programs.
Oh, brilliant. Yeah. Awesome. So you spoke at the festival this week.
I did.
And what did you talk about?
Yeah, I talk about the crisis that we've got with our healthcare workforce. This is a global crisis. We're seeing that people aren't staying in healthcare jobs. For frontline employees, that's about 5 years now. Think about all the training that's gone into, say, nurses and paramedics for just 5 years. So we're looking at why people are leaving the profession and about how we can retain them and change the environment so that they can thrive and hopefully have flourishing 20-year plus careers.
So what are the big things that you're seeing? Why are we leaving?
Well, burnout. Yeah, absolutely. Burnout is huge. And we were just joking before about how cynical we get. And I think it's because of the environment that we're working in. And we didn't go into nursing or medical profession to be burnt out. We want to care, and we care so deeply. So it's ironic that healthcare in particular has got this issue with burnout. So I think we need to start caring for the carers.
Yeah, absolutely.
Yeah.
So what does the future of healthcare look like in terms of that?
Yeah, so a thriving workforce which is digitally enabled. So a lot of our time is spent doing administration tasks or systems that are broken that just make our days so much harder. So if we can get AI and other amazing innovations in to help the healthcare workforce, because putting more people into a system that's broken is not going to help. So by looking at keeping patients at home for longer, giving them care in their own homes, means that it's freeing up hospital services so that we can do stuff that we need to be able to do in tertiary centres, and then just really supporting that workforce to help them do their jobs to the best they can do. The other aspect of what we do is making sure that the culture is right. And in healthcare, we have got a
bit of a culture of hierarchy, and we have a bullying issue. So being able to call that out and address it and have proper speak-up pathways to be able to promote psychological safety in frontline teams is just, I think, critical for us to develop the innovation that we need and ability to adopt digital tools because the teams are psychologically safe.
Yeah, wow. So you've come from New Zealand.
Yes.
To the Digital Health Festival. How have you found the experience and key takeaways for you going home?
Yeah, it's been a wonderful experience. We're over in the startup village, and it's just been so cool to hang out with other founders and startups doing really cool innovation. One of the takeaways is I think it's the difficult part of getting from, say, a research innovation or a pilot that you might have done that's really successful and then getting that implemented and scaling up. I think there is a gap that really needs to be addressed. If we want to see more innovation come through, then we're going to have to support that early stage. So, yeah, really passionate about that startup ecosystem.
I'm Dr. Brian Tan, Chief Health Officer for Salesforce. And I work primarily in the public sector, so serving government, public institutions in healthcare. What I do is basically help Salesforce and our clients set the strategy for the future of healthcare and how we can use transformative technology in the piece as well. And I got a lot of toys to play with working at Salesforce, so I'm like a kid in a candy store. Yeah.
Cool.
Yeah.
And I know you've been on lots and lots of different stages over the last few days, but what have they been about? What have you been moderating?
Yeah, basically listening to a lot of our client partners' stories around how they're using new wave technology that Salesforce has to transform the way they're doing things, and essentially to bring the person back into the center of their organizations, because that's what Salesforce is about. It's about bringing the person back into the center of care. We've got a lot of emphasis in process and policy in healthcare, and at the end of the day, our primary research suggests that sometimes the patient or the citizen, still the consumer in healthcare, is being left behind. Yeah. So there's still a lot of traction to go, which is one of the major reasons why I've actually moved into this area. After working on doctor and nurse workflows for almost a decade, and I've been in health informatics now for over 20 years. Really, when a friend posed me the question, are you interested in maybe taking a tilt at patient centricity? So I thought, that's an interesting problem statement. So I moved across about 3 years ago, and it is still a growth area. It's still an area that I think we can go a long way to improving how we as consumers in healthcare experience our interactions with the healthcare system. And even when we're well, how do we still continue to transform the way in which we're managed? Because most of our care is not necessarily within the walls of a hospital either these days.
No.
Yeah.
Empowerment and accessibility of those services for the patient, and giving them the knowledge and information to then be able to use it to their own good.
Perfect. I couldn't have said it better, Ruby. Yeah. No, and our primary research supports that too, that, this is where healthcare is shifting. And so the future of healthcare is essentially shifting towards a patient, citizen-empowered model. We see that in a funding model from aged care to disability, where we're shifting towards consumer-directed care. That's basically a formal acknowledgement of the fact that we want to be treated where we want to be treated, we want to be managed where and when we want to be managed, and in the way in which we would prefer. At the end of the day, at the heart of that is really, we just want to be treated as people, not as another number to be processed, not as a throughput job. So that's what we're trying to employ our technology to do, is how to bring the person and our relationships back into the center of what we do.
Yeah, great. Yeah. And I know there's probably a lot of focus as well on the workforce side of things and the ease of work.
That's true.
And making those systems a bit more fluid, I guess.
Yeah, that's right. I think there's two aspects to that. We see a lot of investment historically in building out the workflows for the staff. For example, rolling out a PAD system for our desk clerks, admin clerks, rolling out an EMR for the doctors and nurses and allied health. But we haven't invested a lot in the front end patient-facing systems. And I think that's the next frontier, really, building off and augmenting all the good work that we've already done in PAS and EMR space, but at a hospital level and also at a federal and state level. How do we push more of the, not only information, as you put it, but also the experience and the tech that actually allows an omni-channel approach to the way we like to be communicated. Some of us like to have the face-to-face. Some of us like to have the email. Some of us are tilde, too long didn't read, just give us the short SMS. So we've got to respect that preference and actually work with it, because that's the best way that we'll reach people and change behaviours in health and actually shift the dial. But part of that too is having a system that supports holistic knowledge of a person. We can't actually communicate with the person unless we know who they are and what they like. And so also part of our work and our challenge at Salesforce is building a data model that it helps us understand that person in their holistic entire sense as a person, not just as a clinical case with diagnosis and medications attached to a picture of you. Yeah.
Absolutely. I guess that's a really nice lead into my next question and telling me what is your vision of the future in healthcare?
Yeah, okay. I guess our vision at Salesforce is that we're just going to use a lot of the technology that a lot of other industries have done, but lend a nuance to the way we're applying that technology. And those other industries are using it in a way that, for example, makes you excited about the upcoming stay for your weekend that you've booked on their platform. Use those same engagement technologies and some of the back-end juiciness as well that we have to then provide a system that supports individualized, engaging communications and experiences for patients interacting with the healthcare system. So I think that's what we want to do. And other industries have already embraced it. So I think it's just an education piece, and that's part of the reason why I'm here at the Digital Health Festival, is just to do the education piece, to let all of my clinical colleagues and C-level executives know, as they're taking care of the people who they care for in their organizations, that this technology has actually already been embraced in other industries, and all we really need to do is just apply it in our respective areas in care, from hospital space to primary care, from aged care to disability, multiple areas.
Yeah, great. And then I hope the regulation follows, I guess.
The regulations are already there, and there's still a lot of work to be involved as well, but we're seeing significant shifts there. For example, in aged care, post-Royal Commission last year, which highlighted the need for transparency, the need for dignity in aged care. And so we're trying to support some of that work as well, obviously, from federal down to individual providers who use it at the pointy end of care as well.
For more content and community about technology and healthcare, visit talkinghealthtech.com.